Good morning or afternoon, depending on your time zone. I am Tamika Leslie with the BUILD Initiative. Hopefully everyone is excited about today's webinar. Our topic is Preschool Development Grant Birth-Five, the application preparation, and you'll be hearing thoughts from our National TA Collaborative to maximize federal early childhood investments. I'm going to quickly walk through today's agenda. First, you'll hear from Susan Hibbard, the Executive Director of the BUILD Initiative, and she will share a little bit about the history of the TA Collaborative and who's been a part of that. Then we will turn it over to Yvette Sanchez Fuentes, Vice President of National Policy at Start Early, and Yvette will walk us through an overview of the PDG Birth-Five funding opportunity announcements, fondly referred to as FOAs. You may hear that again later on in the PowerPoint. And after Yvette, we will hear from Jeff Capizzano, who's the president of the Policy Equity Group. And Jeff is going to talk us through how you might want to think about your approach to the needs assessment and strategic plan components of the grant application. From there, Jeff will turn it over to Carlise King and Dale Richards from the Early Childhood Data Collaborative at Child Trends. We'll go back to Susan very quickly with a word about resources that we have collated for all of you here and some offers of technical assistance that the TA Collaborative will be providing. Last but not least will be some Q&A, so please feel free throughout to type your questions in the chat box. We will try to address those as we go along. And knowing that there could be lots of questions, we will certainly provide follow-up resources and answers to any questions that we can't address today. I would like to ask, before we really jump into the subject matter experts, if we could all get started by typing your name and the state that you represent in the chat box. And hopefully we'll hear some very interesting and helpful tidbits. I will turn it over to Susan and let her take it away.
Thanks, Tamika. So, hi, I'm Susan, as Tamika said, with the BUILD Initiative. And this group, the National TA Collaborative, first came together around the Early Learning Challenge. And it's grown and shrunk and become a little bit more formal, but it's definitely remained somewhat informal over the years. And it's really just a coming together of lots of the organizations that work with state leaders across the country on early childhood systems. And when we came together around the Early Learning Challenge, it was because we were so excited about the opportunity that the federal investments represented. And, really what was one of the first times and really the major first time that there was money for early childhood systems development. And so at that time, we came together both to offer support during the application phase, which obviously the federal TA centers can't do, and then throughout the implementation of the Early Learning Challenge. And, shortly thereafter, we came together again around the Early Head Start childcare partnerships and held a meeting for community leaders and state leaders in Chicago. That was just an open call and also live streamed it across the country. And so over the years, we've come together at various times when there was an opportunity. And then at a certain point, we realized that we should just stay together, not just in a frantic frenzy when something great happens at the federal level, come together, but that we should periodically, and now we do it quarterly, have a large meeting of organizations that work with state leaders on early childhood systems and keep sharing information and sharing resources and working on them together. And this group has sort of been bound together by just a few common beliefs that some of us work on, birth to 5, some of us work on prenatal to 8. We work on different aspects of the early childhood system, but we all agree that regardless of what our own role or focus area is, that the larger early childhood system is a key commitment and vision that we all hold. and that we all support the idea and approach of focusing on the whole child in whole families and communities and whole systems work. So although much of the work we do together is focused on early care and education and early learning, we agree that children's healthy growth and development is connected to families and communities, and not just to early care and education, but to health and mental health and the social determinants of health, to housing and economic security and nutrition. So, those common beliefs. And then also that when we work on especially grant applications with states, that it's not just about winning the grant, although in a competitive grant setting, that's important, but it's about making sure that you're working towards the vision of your state, that you're working toward, a great state plan, that you're working toward a racially equitable early childhood system, and that you're not contorting yourself to something that, a lot of different federal agencies finally agreed to in some weird application, but that you're really writing a plan that you want to live out, and that the values and vision in that plan are something that will benefit young children and their families. So we came together around those things, and the belief that together we're better, that we can, create better resources, leveraging each other's assets, and that we can support states by coordinating better and not all falling all over each other. So we've, supported the PDG B-5 application process from the first one, and are doing it again this time. And we also worked together throughout the federal recovery and stimulus funding. So I know you can read this slide. So these are the groups that have, and I'm sure I left off some, but who've come together over the time. And sometimes groups are very actively involved in it. Other times they're not. People, and groups come in and out. But I just wanted to say that there really is a range from groups like the National Association of Early Childhood Specialists and state departments of education to groups like 0 to 3, think tanks like the Urban Institute, to groups like the Hunt Institute that works with elected officials, NAEYC to Start Early, New America, First Children's Finance, the Bank Street, CLASP, CSSP. They're just, tons of groups, the National Head Start Association. And it really just is a chance to learn with and from each other, and to collaborate as we try to support you in doing the great work that you do in your states. And we just wanted to say a little bit about who you are. So you're from 44 states, the District of Columbia, and 2 US territories. And about 2/3 of the webinar registrants indicated your race and ethnicity, and 63% of you indicated that you were white, and 22% of you indicated that you were African American or Black, and 7% indicated that you were Latino or Latina, and then 3% each said you were either Asian American or American Indian or Alaskan Native, and then 2% said other. So that's who we know who you are, and then you've written in the chat your names and the states that you're from. We also asked you what roles you are playing in the PDG B-5, and this is a little wordle of what you said. A lot of you indicated that you were part of a writing team of an application process. Some of you indicated that you were trying to have impact on the content that would be in the grant, or you were part of an agency that was working on the grant, or you were helping, but sort of that's what we heard about your role. And now I'm going to turn it over to Yvette to talk a little bit about what's in the FOA.
Awesome. Thanks, Susan. Hi, everyone. Good morning, good afternoon, and thank you so much for joining us. My name is Yvette Sanchez Fuentes. Currently serve as a Vice President for National Policy at Start Early. I'm going to give you a overview of what these 2 opportunities look like, but also hope that you've had the chance to read them as well, and just would remind folks to please go ahead and add your questions to the chat or the Q&A, and we'll do our very best to be responsive to that. So here's kind of the basics. Most of you are pretty aware that there are 2 opportunities available right now, a planning grant and a renewal grant. It is a short turnaround time. The grants will be due, or your applications will be due on November 7th. And so what you'll hear today hopefully will help get you started on that path to getting those applications complete. These 2 opportunities are really, as Susan mentioned, some of the only funding that's available for early childhood, to think about state systems and how you create some alignment and coordination across that. And we'll talk a little bit about each one individually. So just very quickly here, as you can see, there are 10 states and territories who are eligible for the planning grants. And then 24 states and territories who are eligible for the renewal grants. A couple of things to just quickly note on this. If you're part of the planning grant process and the renewal grants, you will need to either update or complete a needs assessment. And I know that you're going to hear a little bit more about that from the other experts who are on this today. So we really want to make sure that you get the information that you need for that. So you'll need to do both a statewide needs assessment and a strategic plan. If you're in the renewal grants, obviously you can build on what you have. If you're in the planning grants, you can also build on what you have, but you're also probably going to start to think about other ways of coordinating your early care and education systems across your state. All right, so a couple of big goals here. Both of these funding opportunities are really calling for the coordination across early care and learning programs and services. One of the things that we really want to point out here is that for both of these opportunities, you want to be able to talk about what you've done with the COVID dollars or the ARPA dollars, and how can you continue to build on those in order to continue to coordinate your early care and learning systems. You want to make sure that you're addressing challenges that have been caused by the pandemic, and you want to make sure that you're able to talk about how these funds are going to continue to support some of the programs and services that you have already started. Obviously, most of you know this, right? You want to make sure that any programs or services that you are going to suggest that you're going to implement through this money is really targeted at low-income families, and that you're focusing on creating alignment that is preparing kids to enter kindergarten. So you'll want to talk about that specifically. I also want to mention that the grants also call for improving transitions from early care and education into the K-12 settings. One of the things that we'll also mention very quickly is that on the renewal grants, there is some language in there about making sure that you are providing sub-grants to early care and education providers at the local level. And so really want to take that into account as you're considering the alignment of systems across the board in your state. So a couple of things here that I already talked about, but let's just go through them really quick again. You want to be able to make sure that you talk about how your COVID dollars have been used. You want to make sure that you're able to build upon anything that you have started, or you want to talk about how you're going to fill in the gaps. You want to make sure that your programs are high quality. So how are you doing that as you're aligning the systems? I think we're going to talk about this in the next slide, but and making sure that you're meeting the needs of families. So in the RFPs, you'll see that there's a lot of language around making sure that you're including families and communities and professionals in the process of what you're going to be creating. And most importantly, that you want to take into account cultural nuances that are happening in your communities. There's a lot of language around the workforce, right? And I think we all know why that is. We're in a crisis, and we really want to make sure that we're building on plans that are sustainable and for the long term. So really thinking about strategies that will raise wages, that will support professional development, and most importantly, that will contribute to making sure that your professionals and your staff really stay in your programs as long as possible. And obviously, you want to make sure that you're creating systems that allow for access for a variety of individuals. You want to make sure that your workforce is diverse for across settings and programs, and making sure that we're meeting the needs of kids and families there. So what's different this time? As most of you have already read this, again, lots of language on workforce. But one of the things that I do want to point out here is that in previous iterations, you saw the language around mixed delivery systems. And I think what we learned is that a lot of states ended up focusing on infants and toddlers. And so what we want to really iterate here is that this isn't necessarily about infants and toddlers, but really thinking about a mixed delivery system. So thinking about that alignment from the continuum of prenatal into school entry, and really thinking about how you're going to be able to build efficient, effective systems in order to support all the kids across a multitude and diversity of programs that are within your state. And we keep talking about sort of how you use pandemic dollars. So again, this is, I think, really an effort to make sure that we're using our funds effectively and efficiently, and we're building on, particularly in states that have used all of their dollars, on what has worked, and for those who have not, on filling in the gaps. So I think we're gonna focus on the workforce. You already know there are a ton of strategies out there. Some of you have already been doing some of these things for the last 2 years with some of the ARPA funds, so continue to build on that. You want to be bold, please consider those mixed delivery systems and really think about the continuum of birth to 5. We know infants and toddlers is an important piece, but again, really want to start to think about that continuum so you can start to think about those transitions. Take successful pilots and spread them. So again, building on what you've learned and what's going well, and use this money to keep sustaining the efforts that you're already doing. You cannot stress that enough. And if you're getting a planning grant, make sure that you're thinking about how you can build towards implementation. So how are you going to be able to sustain whatever it is that you put forward on here? And so with that, I'm going to turn it to Jeff.
Great. Good morning, good afternoon, everybody. Great to be with you. I'm Jeff Capizzano. I'm president of the Policy Equity Group. It's a early childhood consultancy here in Washington, D.C. I've been involved successfully with 5 PDG B-5 grants, 2 initial and 3 renewal across 3 states. And I just wanted to share some of the lessons learned from the writing all of those grants with you today. But I will talk mostly about the needs assessment and strategic plan, but I did want to point you to 2 resources that were developed for prior PDG applications that I think are still relevant. One of the frustrations about the grant is that, you have 75 pages that includes your sort of core sort of grant application, and then the appendices, and then you have to write across 6 activities, logic model, program performance improvement plan. And so it's really hard not to sort of approach this just as a questionnaire, right? So one of the things that we wanted to do with this guide that I co-wrote with Harriet Dichter was, well, how do you think about a process that then leads into the application? If you can go to the next slide. So what you'll find in this document is, here's an approach that you might want to take to really think about what you need to do as a state for your system. And then through that process, then align that with sort of what you have to write about. And so using kind of this model, it really takes you out of the just trying to hit every criteria and more into a sort of a coherent plan for the state. And so I think, Susan has emailed that out. I also include the link in the slide if you want to look at that. So that's one resource I wanted to make sure that you were aware of. The second one is one of the things that we worked, you can go to the next slide. One of the things that we worked on was really taking a good look in 2018 at the initial applications, just to see what states were writing about. And essentially what we wanted to do there is just kind of look to see what states were proposing sort of what weaknesses there were in the initial grants and how, as they were thinking about their renewal grants, they could sort of strengthen sort of the work. And so, we propose a lot of recommendations for the new renewal grants. These are granted based on sort of the initial applications pre-COVID, but there are recommendations related to equity and infusing equity into the applications. There are recommendations related to making sure that you're really hitting sort of on all of the different programmed within the early childhood system. And then there's obviously a lot of discussion of the workforce and how it relates to, supporting dual language learners and professional development opportunities. And so I just wanted to make sure that you're aware of that resource as well. And so, wanted to talk about the needs assessment. I think, what's interesting is kind of looking at the application, that came out. The application isn't that much different than the ones that were pushed out in 2018 and 2019. But what did change is the world. I mean, it's an incredibly different context in which we are trying to administer early childhood programs at the state level. And so I think, I know all of you are trying to push out sort of the ARPA money and you're busy. And I think, why would you apply for this grant? And I think this is like the main reason why you would really be thinking about, applying for a PDG grant is it gives you the opportunity to really reflect and to better understand everything that has happened over the past 2 years in a way that will help you improve the system moving forward. And so, when I'm thinking about the needs assessment for this, and I am writing at least one state grant, this is the way that sort of we're going to be approaching it is, really thinking about these 3 big changes that have occurred since the last time these applications came out. Obviously, one was COVID, and just really trying to understand how the pandemic has changed providers, how they've changed parents, how it's changed sort of children. And then, all of us, in these states have received significant amounts of, funding, for stabilization grants to try to do different things with CCDBG. And so, the question is, how was this money used? What have we learned from all the things that we tried to fund during that period? And so that's another sort of role, I think, of the needs assessment in this application. And then, we had George Floyd, and we have, just a new equity perspective nationally, and we have the president pushing out sort of a racial equity executive order. And so we need to be thinking about in this application, what have we learned about the structural issues within states, that are perpetuating inequities for providers, parents, and children. And so how do we sort of think about that as we're updating our needs assessment? And so, we need to think about sort of the past and sort of the impact of these things that have sort of recently happened, but we also need to be thinking about the future too. I think, there is, language in Congress. There's a sort of a marker bill on the Democratic side. There's a marker bill on the Republican side, really to change the CCDBG, to reauthorize CCDBG, and with sort of an emphasis on building capacity. And so, what can we do with this needs assessment to prepare, and the strategic plan and the rest of the PDG application to prepare ourselves for sort of, potentially additional funding next year, and an emphasis on capacity building sort of at the federal level. And so just kind of thinking about sort of, these questions related to the impact of COVID, obviously, one of the things that we need to focus on, in the application is really what impact did it have on system capacity. I think if you look at sort of the numbers that came out of Berkeley, the Center for the Early Childhood Workforce, they're talking about we're operating basically at 90% capacity as compared to pre-COVID. And so the question is, what does that look like in your state? I know there's a lot of variation across the country. There's also a lot of variation within states by geography, by ages served. We need to get a better handle on that. And so that's sort of, I think, a primary question for the needs assessment. Also, given sort of the language, in, some of these federal pieces of legislation related to capacity building, what do we know about our facilities? Do we have spaces that might be ready, shovel ready for, for additional funding to get them to be licensed early childhood programs? And, I think, we've been evolution of sort of understanding sort of what capacity looks like within a state has been changing. So we've, had really, great information coming out of the Center for American Progress around sort of childcare deserts. And so now we're kind of moving into the next generation of what it means to sort of, measure capacity. And, the Florida Index of Childcare Access is a really interesting tool that's being used that sort of incorporates quality into the measure of capacity. So I would urge you guys to look at that and also kind of think about how you might want to address this capacity issue and think about the capacity issue in your state. The other thing about COVID is it's just changed all of our behaviors. It's changed parental work, with the way we work. It's changed our childcare decisions. And so we need to be asking parents about how they might be working differently, how are they choosing childcare differently. And then, there was just clearly a disproportional impact of COVID on certain populations. How are these populations faring? What other services do they need? So we need to, there's a parent component to this. I think the other big thing that's interesting is, there's been this growing awareness among businesses about the importance of childcare because of COVID. How do we sort of, work with businesses in the needs assessment to understand what impact it's had on their productivity and how they might be helpful. And then obviously, what has the impact been on children? It's an impact on mental health, their school readiness, how they connect with other adults. And then, thinking about sort of the federal COVID, the COVID relief funding, there are really key questions about allocation, like who received the funding and why did they receive it? I know the formulas for the child care stabilization grants were really interesting and different across states. Some used the social vulnerability index, some used sort of other ways of allocating the funding. And so, but what do we know about sort of how well that distribution formula worked? What was the implication of these allocation methods on who received the funding? What lessons can you learn from that? And what does that mean sort of for the future of your system? I know a lot of states have, they increased eligibility thresholds, they increased subsidy reimbursement rates, they provided bonuses directly to providers. What did the take-up rate look when you increased eligibility? Sort of what, did more providers come into the system because of the reimbursement rate? What did they do differently with their staff as a result of the increased reimbursement rate? Again, all these questions are completely appropriate for the needs assessment. And then obviously sort of what impact did this have? Are providers being better served? Are children sort of, their development being better served, with these changes that you're making to the system? So, thinking about allocation, take up, and impact as you're thinking about the needs assessment as it relates to the federal funding. And then just kind of thinking about, your questions or methods from an equity lens. There's a lot of language in the FOA about sort of barriers to participation for parents and providers. Are there administrative barriers, language barriers, transportation, technology? Sort of that's something that you need to sort of update and think about for this needs assessment. And then, the Center for Study of Social Policy came out with a really interesting report on the way that certain states have engaged stakeholders. And Michigan has had this institution of trust model where, when you have, vulnerable populations that might not trust the government, who do you go to in terms of organizations on the ground that you can leverage to support information dissemination and do some of the needs assessment work for you? So the question is, who are your institutions of trust? Who do you go to when you're trying to both understand what's going on in the state, but also to be able to push out information about services? And then, amazing innovations in the way that stakeholders are being engaged, human-centered design, dialogue circles, process mapping. And so hopefully you'll be, thinking about employing some of those methods as you update your needs assessment. And then just, kind of quickly about some considerations specifically for the workforce, because obviously, as Yvette said, there's a strong workforce focus in this. I think, there's a lot of conversations about sort of wage parity and how you might achieve that. I think, the first thing, you need to start with is kind of a wage comparability study. So how do the wages of childcare providers compare to other sectors that require similar degrees or credentials? Because, I think wage parity in theory is something that we want to achieve, but how do you align the different positions and of sort of, Head Start programs, school districts, childcare providers? It's not as easy as it sounds. And so I think the wage comparability study is one way of sort of doing that alignment and figuring out ways in which you want to do to sort of address wage parity. We've done some workforce surveys where we've asked providers about their wages and benefits, but really the most interesting findings have come out about, the level of stress that they're feeling, how they feel about their workplace culture, their morale, the PD that they feel that they need to do their jobs better, how their stresses around difficulty paying bills. And then the most troubling statistic has always been with the very low percentage of providers who plan to be in the field in the next 5 years. So, workforce survey tells a lot about sort of what you can expect sort of for the future of the workforce. Higher education inventories, professional development inventories, making sure that what is being offered in terms of education and professional development, it really is aligning with what you want providers to know and be able to do. That's another big part of the needs assessment. And then, leadership is always key, and figuring out who are your leaders, how diverse are they, will they still be in the field in 5 years? And so these are, some specific considerations that you want to be thinking about related to the workforce in your needs assessment. And then I think just quickly on the strategic planning section, I think one of the things that was interesting about feedback from stakeholders when we were doing the strategic planning process, and I think Susan alluded to this at the beginning, she was talking about like when we did the needs assessment and didn't circle back in the strategic planning process, and the strategic plan just kind of landed on some of these stakeholders, they felt there was like a culture of extraction. We're just taking information from them, and we're not sort of making them a part of the solution in that process. So when you think about the strategic planning, you need to just replicate the needs assessment methodology. You need to circle back to the stakeholders. What did you hear? What did you find? And then talk to them about what they feel that needs to change in the current strategic plan. So the focus groups that you might have done with your, as part of your data gathering for the needs assessment then becomes, they become your strategic planning team. So it's really important to continue to loop them into the process and write about that in the application. You should probably provide a template for the strategic plan. You have a state vision, you outline the vision, and then what are the goals that you're going to try to address in the strategic plan. And then the other big piece related to the strategic plan that's really important is that you need to make the case for the fidelity of the implementation of the plan. How do you ensure stakeholder buy-in? How do you make sure you tell the reviewer that you have the adequate state capacity to implement the plan, you're communicating it, you're monitoring progress that leads you into that program performance evaluation plan section later. So those are just some quick considerations for the planning section. And then just a bit of nostalgia. This was sort of a photograph from the writing that I supported in Maryland with my friend Stephen Hicks, and just wanted to show you that we do, I practice what I preach, and this is a sort of our initial shot at doing the process that I outlined at the beginning, where, okay, what is our vision for the grant? What are the goals we're trying to achieve based on that vision? What are the activities that will meet the goals? And then sort of laying that out first, planning, and then going and trying to write it into the sections of the application. So I know that was very quick. Looking forward to your questions, and this is just the start of the conversation related to support. So looking forward to working with all of you throughout the PDG B-5 process, and I'll hand it over to my colleagues at Child Trends, Charlie and Dale.
Thanks, Jeff. I thought that was helpful leading into our conversation, where we're really going to be talking about sort of data as a core part, underlying a lot of the activities, and thinking about how you can plan for this and embed this into your application. So as was mentioned, one of the goals of the grant is to support greater coordination and integration of early care and learning programs. And data is a core part of that coordination. And so I think what we were talking about is specifically, it notes the developing and implementing of integrated and collaborative state data systems to support data sharing, to strengthen your state's capacity to access and connect data across all children, program, and workforce, being really important in sort of creating that vision that Jeff was talking about. You see this in the needs assessment information that Jeff laid out. I think one of the key things that'll be important is to think about what your current data infrastructure looks like, what data you have access to in order to answer all of those questions. It may be administrative data, it may be conducting a study, or it may be conducting focus groups or individual interviews with stakeholders. So really having a clear plan and articulation within each of the activities and across, and thinking about your infrastructure of what you need for that needs assessment. As Susan mentioned, please check out the resources. There are many resources that have been shared through the website that Bill put up, and also resources that have been developed from the National PDG Technical Assistance Group that really provides great guidance and recommendations around documenting, doing evaluation, and building a strong data infrastructure. So for example, I'll mention some from Child Trends. We have an access framework that talks about different multi-dimensions to assess when thinking about access and defining these terms, and then also making recommendations on how to measure that and what data sources that you can access. Your data infrastructure is going to be really important in understanding the changes for COVID as well. We have a resource that's coming out this week. We will share around an update that's specifically a guidebook on how to track COVID funds. And similar to how Jeff has shared, it's really thinking about your state goals and then identifying sort of the key outcomes and questions and the associated data. And I think it's really important to think about too, as you're thinking about advancing equity, thinking about the data that you need for identifying not only the outcomes, but understanding the processes that you're and the policies that you're implementing, and knowing what does and doesn't support communities, and really making sure that you have the data that you need and information to target resources that can then help, and you can articulate when you're changing policies in order to make sure that resources are meeting those that need it most. And you'll see resources up there on defining equity in all processes, from data collection, use, and communication, to be thinking about and planning for in your plans. And you really want to be able to also think about how you will lift up what is working in your communities, as well as areas that how you're going to track improvement around specific interventions, or as Jeff and Susan and Yvette had mentioned, pilot projects that you might be doing as part of your work. For all of your grant activities, you want to be able to articulate how you will track and assess your project goals, how your existing data systems or input that you're going to be gathering from partners or community members will be used to really help understand progress. And thinking about the evaluation and monitoring piece, kind of over time, you also want to be able to make sure that you have sort of clear processes or ways that you're going to identify how progress will be measured and how often it'll be measured. I think what you want to be very careful about is not over-promising for what data you have available. I think part of the needs assessment is identifying like what additional data you may need or need to build in to the grant to build your capacity. So part of it is going to be describing your current systems and how these can be used for evaluation and also for continuous improvement. So as I mentioned before, a key part of the coordination is connecting data about young children, family, and the workforce. And for a lot of states right now, accessing early childhood data is like putting together a big puzzle. And to assess really the strengths, identify needs, and to track progress related to your early childhood investments, such as home visiting or childcare subsidy programs, your program improvement initiatives, and the workforce, requires connecting data across different state agencies. It'll be important that you have a way to clearly define what this puzzle looks like for you in your state. Because from our experiences, it is very different from state to state. And often when you're writing about how you're going to be able to monitor and coordinate services, as well as data you need to understand progress and in your goals, it's not always clear to somebody outside of your system what you're bringing together, what's currently disconnected, and what needs to be brought together as part of the process. So you want to really be able to map that out clearly in your application. So take, for example, this image that I have here of early childhood programs organized by different state agencies. For information as simple as getting a count of the number of children served across programs requires that agencies share data. So you want to be thinking about, as you're outlining your systems coordination, what do you know about the current systems? What data do you have access? Do you have plans to build partnership? Looking to the next image, data integration brings all of these pieces together by linking multiple records about children, the programs, and educators. And this is how you'll get a complete picture of strengths and needs. And in this triangle, we're sort of bringing together early learning data, but also thinking about what type of access you'll need to other health or social services programs as part of your plan. Again, you want to have a clear picture of what your state or territory and programs that are going to be represented in that triangle. Integrating data across these systems are what early childhood integrated data systems are being used for and being developed for. And within an early childhood integrated data system, this is being used to support data coordination. And it's helpful that these are usually guided by your overall policy questions you're trying to address or key state goals. And some examples are who's being served across programs. And this is a lot of the things you're going to want to answer through your needs assessment, their access to health and other financial support programs, having a means to identify characteristics of effective programs, and understanding the availability of the workforce and current compensation and training, and how these programs are being implemented. So this is a high overview. In each of these areas, you're going to want to clearly outline your goals, how your current or planned data infrastructure will support the monitoring and continuous improvement toward that goal. But I wanted to take a quick look as an example of around workforce data. So this slide provides examples of uses of data that are intended to squarely focus on the needs of the early care and education workforce. For example, having to make sure that you're developing policies to build a pipeline that supports the current as well as the future workforce, you're going to want to make sure that you have data to be able to support and monitoring that. We know, as was mentioned before, as a result of the pandemic, we're losing a lot of staff at an alarming rate. So it's really important to have a plan for how your data, to know how we're building back the workforce and how it may be changing as well. It's also important to understand current status and characteristics of the workforce and to be proactive with sort of policy solutions or changes or sort of readjustments to your approaches to ensure that professional development systems and career pathways are accessible to educators in all settings. And again, I think, for example, like, do you have data just on workforce for centers? Do you need to do something additional to make sure that you have information around in-home providers as well? We have a workforce that is culturally and ethnically diverse, which is a strength. However, we've seen that systems are not always set up to celebrate and build from these strengths. So an example, a key area you may track is language accessibility for professionals, and having information about languages spoken by staff is going to help to inform the need for trainings, curriculum, application processes, and educational opportunities. Low wages and wage disparities, which was mentioned earlier, having that data by race has been an ongoing barrier to the disparities by race have been an ongoing barrier for recruitment and maintaining a well-trained workforce. So again, increasing compensation, you want to have that data to be able to look at it for different populations, and data not only on wages, but also as benefits to understand how different initiatives are achieving that goal. The last two uses of workforce data I've identified in this example are to evaluate who and doesn't have access to professional development systems, financial supports, to see whether educators are advancing along a career path or getting stuck. And then you also want to know how the workforce development systems do or do not build roads for professional development and clear pathways to advance people in the profession. And this is an example of kind of overall thinking about what type of data you're going to need around each of your different activities, but knowing who is currently part of initiatives are reaching and not reaching is important to know, sort of make sure that policies are supporting access for all professionals in the field. So overall, you're going to want to have actionable data that supports the development of professional development and workforce policies that benefit professionals regardless of where they work, the languages they speak, and the communities in which they live. The process for how we collect and use data is so critical in improving the equity of our systems. I'm going to hand it over to Dale next to share some strategies to consider in your plans and some key components of your data systems that you will need to support greater coordination and integration.
Thanks, Carlise. So as Carlise noted, we want to discuss some strategies for you to consider as you're writing your approach and developing your plans. And these strategies are ones that should be employed by anyone involved in using data and with the data integration process. So in particular, it's critically important that those involved in data governance, especially embed these strategies at all stages of their work, as we know that data governance and the data governance entity is the authority over integrated data. So the first strategy or first step is to really prioritize equity-driven questions or these use cases to guide the data integration efforts. I'll share some examples on the next slide of these kinds of questions, but because your questions really should ultimately drive your work, ensuring that equity is considered at this step assists with ensuring that equity is considered at all other steps. And then the next strategy is to not only engage, but also empower stakeholders in data decisions. So that means that you're engaging a diverse set of stakeholders who represent the communities most impacted when data are integrated, such as children and families and educators, and thinking about that engagement and empowerment of stakeholders throughout the whole process when you think about your applications. The third strategy is to always maximize benefits and reduce harm of data use for families and educators. And this includes considering the burden of data collection for families who may be reporting similar data to multiple agencies. So for example, if you have data sharing agreements amongst agencies, that can really help reduce the burden. But at the same time, you want to make sure not to reinforce biased data collection and reporting practices. So for instance, when making decisions about what data to collect and how to report it, ensuring that you're really identifying the strengths and areas for growth instead of emphasizing a deficit narrative. And then the beauty of integrated data is that you can pull together more than one type of evidence to improve equity. So being able to pull data, for instance, across programs or from different agencies really paints a fuller picture of a child or family or educator's experience. But you also want to make sure that families are knowledgeable about how their data are being shared and used and give their consent. We also like to think about and encourage gathering data outside of administrative data that could be shared through an integrated data system or through individual programs. So thinking about other types of data, such as through focus groups or surveys or families, and really considering and the importance of using more than one type of evidence whenever possible to really have a more complete picture. And then in addition to requesting and using the data, how data are shared and whether data are shared equitably is really essential. So the messages that are shared about the work are often what either maximizes benefits or reduces harm for families and educators. For instance, we know that data have been used to deny access to services or stigmatize groups or used for punitive purposes. So this can be really a concern for programs and families thinking about how their data will be used. Rather than thinking about data to support continuous quality improvement. So it's really important that you communicate to all those who are involved and users what this data will be used for, what the data system will be used for, and then what it won't be used for, and then really communicate your findings equitably. And as Carlise mentioned, we have resources on that as well that have been shared. So the Early Childhood Data Collaborative, or ECDC, recommends that you start with the questions that you want to ask with your data. So really having those be a guide to help inform what data you collect, what data you use and integrate. ECDC recently revised their list of policy questions to really be responsive to states' goals, to use their data to reduce disparities and to promote greater equity, which you can see these are the revised questions on the slide. So for instance, some of the first sets of questions are asking questions that require the disaggregation of data to really understand the outcomes and experiences of different populations and families. So we ask, do early care and education systems support all children's development, regardless of race, ethnicity, income, ability, and community for success at school entry and beyond? States will obviously define this differently, but typically it involves thinking about things such as child access and thinking about access in those broader dimensions, as Carlise mentioned, to early learning, health, and supportive services that provide a strong foundation for children's learning. We also recommend designing questions that track the effectiveness of institutional policies that promote intended program outcomes. So are programs designed to meet the needs of families? Are changes over time moving toward or away from a specific benchmark or goal? And what characteristics and policies matter? And then we recommend including questions about the workforce, which we know is obviously a focus of these FOAs, that are framed to understand both the outcomes and supports needed to achieve program goals. So for example, do all educators have opportunities to grow and strengthen and apply their professional skills? What policies and investments equitably lead to a skilled and stable workforce? So these are just the examples of kinds of questions to think about to center equity and to move forward to think about the kind of data that you'll need after identifying these questions. So really thinking about first identifying those key policy questions that you want to answer in your state or territory, and then identifying what data are needed, where are they housed, and then the process needed to access and use those data. There are also important programmatic components or activities that must be conducted to successfully coordinate and use data, including, for instance, building an integrated data system or an early childhood integrated data system. And these include, for instance, a data governance structure that should be established. Those can look different in different states, but it brings together key stakeholders to establish and enforce policies and procedures about how data will be collected, shared, and used. Data sharing agreements that need to be set up. That can be through, an interagency data sharing agreement where there's one agreement or multiple agreements between agencies and IT groups. And then there's typically a process for requesting the data, thinking about clearly determining what the data user will have access to and how they'll maintain the security and confidentiality of the data. And then really importantly, in thinking about this for when you work on your applications, is how to ensure that you have dedicated staff and funding and ongoing stakeholder engagement, which we know are really key successes to sustainability. So these should be really discussed early on, thinking about it from a funding perspective from when you write your applications, and then ongoing throughout the life of the work. And then there are these technical aspects and processes that you need to think about when you're using data or coordinating data. That would include having unique identifiers or a process for matching records at the child and family and site and workforce level. There's also a need to align data using common definitions or standards. We really commonly refer to those as data exchange standards. And then having a mechanism in place to support data interoperability, which is the automatic integration of data without the need for manual or human intervention. And then thinking about tools and platforms to use data to be able to, that can be accessible to different users, but taking into account that some users will need to have more access than others, and a process set up to allow for data to be analyzed and reported and disseminated, again, back to both the needs assessment, the strategic plan, as well as the work that you'll be doing in the activities that you've identified. And then lastly, these data on children and families and educators, it's really critical that you have data security systems and protocols in place. So having data privacy policies and ensuring that those policies are transparent and communicated to all stakeholders. Thinking about all of these components to take into account during the planning process and the resources and funding needed to support these data efforts.
I think I'm going to jump in again for a second. Hi, thank you, Dale and Carlise. That was great. And Jeff before that. We sent out shortly before the webinar just the link to the resource page, and you can see here the bit.ly PDG B-5 resources that has the application guides that Jeff talked about from the earlier PDGs applications, but that we think are really useful again. And then a sort of streamlined set of resources that follow along the sections of the FOA. And we'll keep adding to that. In the next few days, we'll be sending something out that Homegrown's about to put out that'll talk about how you can use the PDG B-5 application to support, to strengthen home-based childcare and ideas about family-friendly neighbor care. And integrating family childcare into state pre-K. So there are a number of resources that will keep coming out to update resources that, for this particular FOA to help you as you move through the FOA and the application. So we wanted to let you know about those, and then just say a little bit about what the TA collaborative and the individual groups within it and then collectively can do to support you if you're interested. One thing is that we'll be offering application reviews for any state or territory that would like to have their application reviewed. We do 2 per state so that you have different opinions, different reviewers from different organizations. And in the past, some states like to get reviews early on so that they can really spend a lot of time with that feedback and make big changes. Other people like to submit a pretty final version for just last minute feedback. We schedule it with you so that we can slot you in with particular reviewers and know when it's going to come and know that you'll get it back in plenty of time for the signatures that you need to get. So we can work with you on that. But then the other things, we'd need to figure out with you exactly, if you want one-on-one consultations with subject matter experts, we need to know exactly what subject and what kind of needs you'd want. So that'll be the kind of thing that we need to hear more from you about what you need and what you'd like. And some of that'll be on the survey at the end of this webinar. And so now we have a poll for you, a question about that. So if you could all answer that, would you like to participate in sort of Q&A, like office hours calls with subject matter experts on application topics? The idea would be that, you could ask a question, but you'd be in a group of people asking questions. So you could also hear other people asking questions and hear the subject matter experts' answers to other people. Would that be of use to you? Okay, so about 64% of you think that that would be useful. Okay, great. So that's the kind of thing we'll be asking you, some in the survey at the end and some outreach one-on-one, and you can reach out to us as well about, which subjects would be of greatest interest. But obviously we can do some in-depth Q&As with like the people on this call about data systems and the needs assessment. We just also wanted to remind you that I'm sure many of you were on the federal webinars that were done, I think, last week. I don't think the link has been put up yet, but those were recorded and will be shared. And they're great resources available from the Federal TA Center. The link is also on the site, the bit.ly PDG B-5 site that we have. So now we have some time for questions. So one question is, what is the process for signing up for the review opportunities that I just mentioned? Okay, so one is, I was hoping that we would have a new email address that we could give you today, but you can just write to our info@build address. Jen will write it in the chat. So you could write to us there, or if you're in any of the groups, info@buildinitiative.org, or if you're in any of the groups that are in the collaborative, or if you're closer to any of them, feel free to contact them, but we'll divvy it out amongst the groups, so you can contact us, and we'll also be in contact with each of the states. Many of you indicated in the registration if you were the grant writer or on the grant writing team, and we'll be in touch with you. And then as well, we'll be asking you that on the exit survey. We're very eager to work with you on all of this. It's a great opportunity. And, I think we were all devastated by other funds that didn't come through. And this is one that, isn't one-time money. It really keeps on giving, and we're expecting, it's in the budget again for next year. So it's a chance for us to keep building these systems better, increasing quality and access and equity. And we're happy to be on the journey with you and support you in making better early childhood systems. So thank you for joining us today. And a survey will pop up when you close out of the webinar, and we hope you'll fill it out and give us more information about how we can support you. And thank you, Jeff and Dale and Carlise and Yvette and Tamika and Jonathan. And thank you for joining us today. Take care.